Hi everyone, my name is Dr. Gina Brelsford and I am presenting to you virtually due to the fact that the Midyear Conference for the Society of Psychology of Spirituality and Religion was canceled this year, 2020. So we have, as invited speakers, offered to put our talks online for whomever would benefit from seeing them. So this talk I'm giving is related to spirituality and stress in the NICU. And in particular, I'm looking at relationships with couples, relationship functioning, and co-parenting. So the learning objectives, because this was to be a CE talk, I'll just leave those in for now. I was hoping to be able to convey to you information on parental stressors in the NICU, and so giving you some information about that so you can then identify those later on at the end of the talk. Also related to recognizing implications of parents' spiritual and religious beliefs and stress in relationship to their relationship functioning and co-parenting. And lastly, I was hoping to convey information related to understanding how parental NICU stressors and parental spiritual views can be related to psychological interventions for parents in the NICU and post-discharge. So my story is one that begins with my daughter, Elise. She was born at 32 weeks and 3 days. Prior to that, I had no experience in the NICU. I had no thoughts that I would end up in the NICU with my daughter because I was a very healthy person that had very good prenatal care, no history in the family of premature birth, no other risk factors noted. I was in my early 30s, so I wasn't yet at the advanced maternal age. And so when this happened, I was shocked. My husband was shocked. And she was born, like I said, at 32 weeks and 3 days. So she's approximately 8 weeks early because pregnancy goes to 40 weeks, as we know. She was born weighing 3 pounds, 4 ounces. And she was what's considered a feeder grower, which are essentially babies that are in the NICU that don't have any other physical challenges or congenital abnormalities. So she was in the NICU for 5 weeks. Usually babies are in the NICU that are feeder growers for the time to age corrected to birth. So around 37 weeks is when they're typically discharged, which was the case for her. And so she basically was in the NICU. And at that time, she is now 12, which I will show you a picture shortly. At that time, the NICU was a very different place. She was in the Penn State Medical Center, neonatal intensive care unit. And this is a medical college also for Penn State University. And she was in the NICU, and at the time, my husband and I were unable to be part of her journey in the sense of rounding occurred from 11, I believe it was 11 to 1 every day. And we had to leave as parents during that time. I do want to say that since changed and parents are now seen as vital in the rounding process. So we are participants in the discussion of our baby's health versus visitors. So there has been some growth in our NICU and other NICUs around the country, but there's still a ways to go. Luckily, Elise did very well in the NICU. The only thing that she had was an IV infiltration around 3 days of age. It was very traumatic for Matt and I, my husband and I, in which the IV solution infiltrated into her skin and created a chemical burn. And she, as a result of that, had consultations with PT and with plastic surgery. There was thought that she potentially might have had plastic surgery due to this burn. She did not, and she was engaging in PT from a very young age. To this day, she has a very large scar on her ankle. Luckily, it does not affect her mobility, and she's an athlete. But as she gets older, she does note that it does somewhat bother her. Other than that, we don't know of any other implications of her prematurity, although she was diagnosed with ADHD approximately 2 years ago, and there is no family history of ADHD in our family. So our husband and I surmise that potentially that could be a result of her premature birth, which is something that in the literature is shown that children that are premature or at a certain born at a certain birth weight have a higher likelihood of dealing with some developmental disorders as well as issues related to executive functioning and learning. Again, we feel very fortunate. Lisa's very smart. She's a very engaging child, as you can see here. There's a picture of her on the left and her with her sister on her right, Camille. Camille also was a preemie. I'm lucky, apparently. She was born at 35 weeks, so she actually missed the NICU, thankfully. And I say that thankfully just because it is a really difficult experience. So anyway, Elise is doing very, very well socially, academically, and we luckily have a lot of great supports to help her navigate some of her challenges with inattention and executive functioning. But she's doing very well, and we're so very proud of her. And that experience really led to my interest in studying the NICU and parents in the NICU and how their NICU parents can navigate that process as adeptly as they can, either on their own or with a partner. So if you look at the statistics, surprisingly, approximately 10% of babies are born premature in the United States, which is a little bit surprising to me. The other surprising thing that I learned was a lot of people, if you are considered a high-risk pregnancy or you are referred to fetal medicine, they often can't tell you why you had a premature child. And so some reasons, certainly there is evidence as to why the premature birth occurred, but in many scenarios that is not the case. And so that can leave some lingering anxiety for future pregnancies. The NICU experience is challenging. There's a lot of unique sights and sounds that occur in the NICU that as parents you may not have experienced before. There's a lot of beeping, there's a lot of babies that you see. If you're lucky enough to have an individual room, then you might not see as many other children in isolettes, which are the where they're typically located due to a variety of reasons medically. And so it's just something that is very different than what you would expect. There's a lot of monitors hooked up to your child. And if you have a medical complication going on with your child's or medical type of intervention, then there's of course more that you're seeing as a parent when you go visit your child. The smells are very hospital oriented. If you've been in a hospital before, there's things you may smell related to cleaning, chemicals, other kinds of things that are just they're very foreign to you. You have to scrub in to see your child. So I'm not a physician, so I've never scrubbed in before. My husband and I would have to scrub in to see our daughter. So that was something that was very odd for us. And the other thing is, if you are not in a situation where you have a private room, you may be in a room with other people. And that was the case with my husband and I, and continues to be the case right now for many hospitals, where your baby is in a room with 4 other babies or 3 other babies. And so many times we would go in to see our daughter, and we were fortunate enough to live very close to the medical center and have flexible jobs. And there would be babies that would not have any visitors because their parents potentially lived hours away. Or they had siblings, and children under 4 cannot enter the NICU. So there's a variety of things that you would see that were hard to navigate. Also, when parents would visit, sometimes there were boundary issues with the other parents, whereas you might be trying to breastfeed your child and another parent would be watching you breastfeeding, which may or may not make you feel uncomfortable. And so there's a variety of issues related to other individuals and if you had an individual room or not. If you have an individual room, potentially you might feel more isolated. That's another thing to consider. Ideally, I personally would prefer to have my own room with Elise, but In some ways, I did find that I would bond with the other mothers when we were talking and holding our children in that space. I would also find that when we would go into the pumping room, I would be bonding with them and talking with them, because that's the other thing you want to know is that as a parent, as a mom, you're highly encouraged to pump breast milk, because particularly the colostrum and the early experiences of breastfeeding are very important for your baby if they can do that. Most babies cannot bottle feed or breastfeed early because they don't have the suck, swallow, breathe reflex down. So Elise had an NG tube, as do most children, most babies. But when she was getting breast milk through that NG tube. And unfortunately, for many mothers, if you aren't actually actively breastfeeding, your milk supply decreases. And so that's also another stressor and another factor related to a lot of emotions during this process, as well as post-discharge. So what we know psychologically for the NICU experience for parents, we do know that there are some long-standing impacts that can occur for mothers and fathers. So post-NICU discharge, we know that in some instances, particularly mothers, may indicate that they continue to experience some depressive symptoms, as well as some symptoms related to post-traumatic stress, and also some anxiety. We also know that in many cases, parents are unprepared for the hospitalization of their infant, and they're not aware of the long-term consequences. And so when those consequences arise, they may be dealing with some difficult emotions. Sometimes this distress can affect people's ability to bond with their infant. So as you can imagine, if I'm dealing with some stress and some anxiety and depression, it might preclude me from being emotionally present for my child. And that could thereby impact some other factors related to the parent-child relationship, developmentally within the child. And relationally, as indicated, there could be some stress between co-parents. So this has been studied less often, but it is something that we consider to be another risk factor if there are co-parenting difficulties during the NICU process related to what potentially parents might see as appropriate, who's going to be doing the diaper changing, who's going to be doing the temperature reading, who can be physically present. If the parents are not in a relationship anymore, how does that work with co-parenting? So there's a variety of things that can happen during the NICU and post-discharge that relate to challenging psychological and relational outcomes.